I'm Courtney Ciarrocca. I'm a fourth-year pharmacy student at VCU School of Pharmacy. I'm currently completing my fourth-year rotations, and for my first block, I was able to do a digital health elective, and one of my projects for that rotation was to create a TPN calculator for our gastrointestinal clinical module. And so a little overview for those who might not really know on what a TPN is. A TPN it stands for total parenteral nutrition, and so it provides the daily nutritional needs of a person through IV access. So that can be either through a regular IV in their arm or through a central line. And so it's going to provide all the proteins, carbohydrates, and lipids you need in a day, as well as the electrolytes. And then we can also add vitamins and specific medications to it as well. So the orders are personalized for each individual patient. So everything is specific to them based on their electrolyte levels or their protein requirements. Everything is going to be very specific to them. And so an order is essentially just like the recipe for their specific TPN with the specific quantities for everything that needs to go into it. And our TPNs are going to be used for patients who do not have a working digestive tract. And so this can be due to either obstructions or certain disease states. Different diseases can kind of impact the absorption in your gastrointestinal tract. And so some people just might not really be able to absorb nutrients that way. And then just a couple other examples of malnourished patients who aren't able to have anything by mouth due to whatever clinical workup they're needing. And then also if you need major surgery and you're not expected to resume eating for more than 7 to 10 days, you could also be eligible for a TPN. And there's many other patients who are nutritionally at risk that would qualify for TPNs, but that was just a couple of them. And TPNs are so important for these patients because their body can't really heal properly without all these vital nutrients. As they're already at the hospital for really not great reasons. And so their body is already a bit stressed. And so not having these essential nutrients would kind of put their health in a bit of a negative situation. And so as pharmacy students in our gastrointestinal clinical module, we had to learn how to do these calculations by hand. They are very long calculations, as you'll see in a little bit based on the calculator. There's just a lot of different things to look at and calculate for them. And any change can have a multitude of changes that it causes downstream. And so it can be hard, especially as a new learner, to kind of gauge the clinical aspect of things when you have to do everything by hand, especially if it's a long calculation and you have to redo everything just to see what one small change would do. And then for me personally, one of the places I struggled with was the fact that our lectures, because it is a long calculation, so it had to get split up over multiple class periods and multiple days in order to adequately explain everything. And it just made it harder to kind of understand the flow of the TPN. And but so when you really are able to get into a patient case and see that, and then being able to just tweak things and kind of see how it impacts the overall TPN order was really helpful for me. And so we do have a patient case that we did in class. And so the scenario is that you are the clinical pharmacist in an internal medicine team at the hospital. And so during your morning rounds, you see a new patient who was admitted this morning for an 8-day history of nausea, vomiting, abdominal pain, and fever. The physician taking care of Mr. BN tells you that they have tried to place a feeding tube in his nose, but he keeps pulling it out. Until they find a diagnosis for his nausea and vomiting, the team wants to start a TPN and ask for your help. And so he is eligible kind of for the TPN because he's a bit at risk with that 8-day history of nausea and vomiting. And if he's pulling out his feeding tube in the nose, we obviously can't use that. And so the TPN is kind of our next solution for that. And so kind of what we know about him is he's 65 years old. He weighs 67 kilograms and his height is 5 feet 6 inches. We also have some of his labs, just so we can keep an eye on some of his electrolytes, which is important, especially with the nausea and vomiting. And so now to kind of go over to our little calculator. Let me just pull it up. So I'll leave the patient case up here, and then So we have our TPN calculator here, so I can change between if they are male or female, because that can impact some of the calculations we do, but he is male, so I will leave it on the male. We have his age, which I can change, and that also can change some of the calculations for us. His weight, and then his height, so he is 5'6", and that calculates to 168 centimeters, which that is something that people just have to calculate on their own. And then over here we have our patient values that we got from our question or our case, and so all these you can edit them and change them to whatever you have. I've already entered in all the values for our patient case just to save a little bit of time, and so we can calculate everything. And then just because it is kind of for students to learn, I have some of the behind the scenes calculations kind of shown there. So if they need to correct the calcium, they need to know that, and so kind of when you would correct that, and his albumin is in fact below 4, and so we would want to correct that. And then there are different fluid calculations that we can use and switch between, and it will recalculate everything for us down here, but we'll stick with the Holiday-Seeger method. And then fluids from other sources, that's really important, just that way you don't overload a patient with fluid with your TPN. And so we'll just say he's getting, we'll just say 250 milliliters in like of an antibiotic or something, but because there is still fluid going into him, that would still qualify, and so we want to account for that. And so with our Holiday-Seeger method, he is requiring 2,450 milliliters a day, taking into account our little antibiotic fluid bag or something. He has a remainder of 2,200 milliliters left in his fluids for the day. And so we'll go ahead and make this a nice even 2 liters for our calculation. And then again, we can calculate everything. And then once we have that, we kind of go into his energy expenditure, so how many calories he needs per day. And again, there are multiple different equations for us to use, and it changes. So like this one would give us a range, and then we would pick between there, but we'll stick with the Harris-Benedict equation because that's what they asked us to use in class. And more so for the other equation, but depending on what their BMI is, that affects if you want to use their actual or their adjusted body weight. But for this one, it's indicating that we'll just continue using with the actual body weight. And so for this one, it doesn't give us a range, it just gives us a value, and then we round it up. And so we want to use that rounded value for our calculations going forward, and so we'll just go ahead and calculate that too, and then we'll roll right into our protein requirements, in which depending on the patient's clinical condition kind of affects the amount of protein we need to give them. And so for our patient, he kind of falls into our pancreatitis section, and so that we're gonna we opted to do 1.5 grams per kilogram a day for the protein. And so going into so once we have that, we can enter it here, and then we choose our protein source. These are 2 that the hospital uses, and we're going to stick with the Travosol 10%. And then as indicated in the chart, for critical care patients whose BMI are over 30, we would use the ideal body weight, but because that doesn't apply to our patient, we're going to stick with the actual body weight. And then we said we were going to do the 1.5, so we calculate that, and then our protein calculations are done. And we'll kind of see them back at the end when we have our final TPN order. And so then we roll into our carbohydrate sources. And so at the hospital, they mainly use the dextrose 20 and 70%, so that's just the different strengths for it, which, as we can see, we want the 70% because we can see that it's only going to add 500 milliliters to our TPN, whereas if we did the 20%, the students can easily see that that is almost our entire TPN, and that is just not going to work for us. So we're going to switch it back to the 70% and continue with our calculations, and it shows them that they're about 70% of the non-protein calories, which is exactly where we want to be for the carbohydrates. And then for the lipids, we have the 2 lipid products that we see more at the hospital, and they're commercially available volumes, along with any allergies that you need to watch out for patients. So if your patient has a soybean allergy, you don't want to use the intralipid, but our patient is perfectly fine with that. So that is what we will choose. And so this is how much it worked out to, a nice even number, very close to one of the commercially available products. And so we'll go ahead and choose the 250. And then this calculates the calories a day for the lipids, and then the percent of the non-protein calories, which is 30%, to round out what is left over from the carbohydrate calories. And so that's exactly what we want. And then we get to roll right into our electrolyte calculations. So we have our patient values that we entered above, the reference range that we like to use, and then a flag for if they are outside of that reference range. So it'll flag if they are high or low in this red bolded font to kind of draw your attention to it. And then it calculates the patient's upper and lower limits for that electrolyte. And then based on what their value is, and the calculated limit, you kind of choose what end of that range you want them to be on. And just like the calcium is a bit low, so we wanted to be a bit on that higher range, and so we chose the 18.6. And then we calculate that to add that to our TPN order. And then it goes into our little electrolyte grid, where after we choose our products for it. So for phosphorus, there are 2 different products. So that way students can kind of see between like what they want to choose. So for this, our potassium was a bit on the lower end of our range, whereas our sodium was kind of on the higher range. So we're going to go ahead and stick with our potassium for our phosphate. And then for our potassium and our chloride, or our sodium, we decided to stick with the chloride options. And then it pops into our nice little electrolyte grid, just so we can keep track of which electrolyte is coming from which solution that we're adding, and how much total for each electrolyte is being added. And then we've also calculated for like when you go to actually make the TPN and you go to compound it, the total volume you'll be adding for each of these solutions. And then we've also calculated the osmolarity. So for this class, we only really focus on the amino acid and dextrose osmolarity to consider for whether or not it can be given in that peripheral line, or if we need a central one, based on if it's above or below 900. And then we also have to keep track of our calcium phosphate ratios, which it is perfectly fine here. But if I were to accidentally add a second one there and then calculate, my phosphorus would be very high, and the ratio would not look favorable for the calcium phosphate. And it would flag me here that I am above 300, and so I need to do something to fix that. So I'll go ahead and put it back to the 21 millimoles that it was at before, and then it just resolves itself back to where we want it. And then this is our final TPN order form. So we have our protein, the carbohydrates is dextrose, and our lipids and how much we're adding. And then we have all of our electrolyte products, as well as any additional things we would like to add. As I had mentioned before, we can add multivitamins, trace elements, some other medications. And so for our patient, we opted to only do the multivitamin and the trace element, but I can add them, so I can add or subtract these, and it accounts for that in my total volume. And so now I know how much sterile water I need to add to this to get to that 2 liters that I want to be at. And I also have my goal rate here. And so that is kind of our little TPN calculator. And so getting a bit more behind the scenes look at it, I have all of my like input, the interactive input things kind of scattered throughout as needed. And then they that way they can kind of flow and continue to be present for the remaining parts of the calculation that I need them for. And so I do start with our BMI calculation, and then from there I can go into my fluid requirements with different equations. And then, and so I have the different equations kind of mapped out here. So based on like ages for this one, and just they all kind of have a little special thing to them, and so that's all mapped out there. And then I also have my energy calculations, which then it goes into my protein calculations. And then once I have my protein done, I can go into calculating my carbohydrates and my lipids. And then I have my lipid products here in a nice table. So that way I can add products or take products out and just easily edit that information. So that way the workflow can still run smoothly if anything changes with the hospital and what they want to use when they're teaching the class. And then I also have my osmolarity calculations for these, which kind of came towards the end. And then I can also come up here and I do my electrolyte calculations, in which we go from our phosphorus and then the remainder goes into the sodium and the potassium. And then we also calculate our magnesium, calcium, and the electrolytes we're getting from our amino acids, such as the acetate and chloride. And then, so within the sodium and potassium they're pretty similar. But we just have a couple different pathways for it to take based on if they're choosing the sodium chloride, the sodium acetate, or if you think the sodium is too high and you don't want to choose a product, you also have a no product option. And that way you don't actually have to add any sodium if you don't want to. And then from there, it all kind of just gets merged together, and then I just reorganize everything into my tables that I need. We do our calcium phosphorus calculations, and then we add up all of our volumes, and that is kind of the end of our TPN calculator. And we end up back with this nice little guy, which is much more user-friendly and interactive than the whole spider web of the behind the scenes. And yeah, so I really enjoyed making this calculator, and I hope it will be kind of useful to next year's students. And yeah, so just thank you for taking the time to kind of learn a little bit about TPNs and take a look at my TPN calculator. I'm very proud of how it turned out, and I kind of look forward to tweaking it as I come up with updates next year as they're using it for next year's students. So thank you again for learning about TPNs.